Hi, welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. So today's video is more of an introduction to a mini-series that's coming up, and the reason I wanted to put it out this way is because I'd really like to get some comments and some questions from all of you, subscribers and people who follow the channel, to really be incorporated into the nature of what we're talking about. So the theme of this is going to be a question that does get asked to me quite a lot, which is how do I find a good therapist for dissociation? And this is relevant wherever in the world it is, because we get contacted from people obviously in the United Kingdom, in the States, Canada, Australia, and in different places throughout Europe and sometimes into Asia as well. And people are really trying to work out how to find a therapist for this. Now, we know there are lots of therapists that are available out there in the world, and we know lots of people can say that they are working with dissociation, but it's really difficult to exactly know. And the thing about therapy is that you don't really know what it's going to be actually like until you start with that therapist, and that can be quite tricky and quite complicated, and it's often a bit of a bumpy road getting started. Ideally it should be nice and smooth, but it isn't. So what I'd really like to try and work with this mini series is the fundamentals of how to make these choices and these decisions. So I'm going to be looking at what type of therapist there are, what kind of questions that you might want to put to a therapist, what kind of research can you do looking at what that therapist is saying, let's say for example on the website or in the blogs or whatever it might be, about their abilities and their criteria and the various qualifications and things. And this is often very difficult for people to understand some of the language used by us as therapists in terms of how we describe what we do, how we do it, and why we're able to do it. So there's a lot to sort of break into this to try and really make sense of this decision-making process, and I'll come up with some hints and tips and some ways of being able to approach this, largely by exactly what I would want to do and through conversations with therapists about how people have found them, and with patients in the clinic and other people who have just said, these are my experiences of different therapists in the past. Some are good, some are not so great, and how we can learn from this and try and sort of use this information to make it more of a straightforward process and hopefully reduce the likelihood that a mistake gets made and maybe the wrong sort of therapist is chosen, and just ways of being able to understand exactly what this process is all about. So one of the things that I'm asking of you, the viewers, the people watching this video and this channel in general, is what sort of questions would you really like to put to me to try and answer throughout this? Because I think it would be going to be really useful if I personalize this as much as possible. So the kind of questions that people will come up with for me are likely to be the sort of things that everybody would want to know. So there's no simple answers maybe, but all questions will be sort of understood and thought about by myself as I make this mini series, to try and incorporate as much as I can do to make this really useful, because this is a really important part of a lot of people's journey through their dissociation, to try and make sense of it, find that therapist that works, find that service that works. And there's obviously pitfalls, and there's some really fantastic information along the way. So please do leave some of your questions in the comments section, and I'll try and incorporate as much as I can do, and I might sort of put some together if there's themes, and then we'll have this mini series to how to find a therapist for dissociation. So thanks very much for watching this, and I look forward very much to reading your comments. So between now and then, please do take great care.